Your pain is real, and I'm about to prove it to you. For decades, doctors told millions of people that their chronic pain was just all in their head, that they were making it up, that they needed to just push through it. But here's what they didn't tell you. Fibromyalgia is a neurological condition where your brain's pain processing system has been fundamentally altered. It's not psychological, it's not weakness, it's not even imaginary. It's real and it's measurable. So here's something I believe that some doctors and probably you don't quite believe yet. Fibromyalgia is not what they call a diagnosis of exclusion anymore, meaning you shouldn't have to spend years ruling out every other possible condition before someone takes your pain seriously. Let me say that again because it's controversial. You do not need to eliminate every other diagnosis first. If you meet the fibromyalgia diagnostic criteria, which I'm going to teach you in this video, you have fibromyalgia, period. The medical community spent decades treating fibromyalgia like a trash bin diagnosis. Well, we can't find anything else wrong with you, so I guess it's fibromyalgia. That's wrong, that's outdated, and that thinking has caused immeasurable suffering for other people. So since 2016, the American College of Rheumatology has been crystal clear on this. Fibromyalgia can coexist with other conditions. You can have arthritis and fibromyalgia. You can have back injuries and fibromyalgia. Having one doesn't exclude the other. So if a doctor tells you we need to rule everything else out first, they're practicing 20-year-old medicine, and you deserve better. Let me give you context for why I believe this so strongly. I'm Dr. Marshall Bahr, founder of Xterra Health, and I have worked with thousands of people suffering from chronic pain, both in the military community and in the general population worldwide. And I've seen a pattern that breaks my heart. People will come to me 5, 10, sometimes 15 years after they've had pain. They've seen 10, 15, 20 different doctors at this point. They've had every blood test imaginable from MRIs, CT scans, x-rays, and everything just comes back normal. And they're told again and again, we can't find anything wrong with you. But something is wrong. They wake up every morning and feel like they've been hit by a truck. They can't think clearly. They can't sleep. Simple tasks like grocery shopping leave them exhausted for days. Their relationships suffer, their careers suffer, and their mental health suffers. And the whole time, they're questioning themselves, is it really all in my head? Am I just weak? Am I imagining all this? No, you're not. Your pain is real, and there is a name for what you're experiencing. It's called fibromyalgia. The problem is, for too long, medicine has approached fibromyalgia as a diagnosis of exclusion, meaning you only get diagnosed with it after ruling everything else out. But that outdated approach leaves people suffering for years while doctors chase down every other possibility. The good news? The diagnostic criteria changed. In 2010 and again in 2016, the American College of Rheumatology updated the criteria to make fibromyalgia a positive diagnosis, meaning if you meet that criteria, you have it. You don't need to wait years. You don't need to rule out everything else. And that's what changes everything. So let me raise the stakes for you because this isn't just about getting a label or a diagnosis. This is about your life. What happens if you don't get properly diagnosed and treated for fibromyalgia? Well, your pain will continue. Your fatigue worsens. You start withdrawing from activities you love because you just can't do them anymore. Your relationships strain because people don't understand why you're always tired, why you're always hurting, always canceling plans. You might lose your job because you can't perform at the level you used to. You might develop depression or anxiety from the chronic pain and the social isolation. You might start questioning your own sanity because you feel so broken, but doctors and physicians keep telling you nothing's wrong. And here's the reality and the real insidious part of it all. Untreated fibromyalgia gets worse over time. The longer your nervous system is stuck in that hypersensitive state, the more entrenched it becomes. It's called central sensitization, where your brain literally rewires itself to amplify pain signals. But here's what happens if you do get properly diagnosed and start treatment. First, you get validation. Someone finally tells you, yes, this is real. Yes, this has a name. No, you're not crazy. Second, you can start treatment, medications, physical therapy, lifestyle modifications, pain management strategies that actually help. Not cure, but they help, and you get some of your life back. Third, and this is huge for veterans specifically, you become eligible for VA disability compensation if you can connect it to your services. We're talking about monthly compensation ranging from $171 to $755 per month, depending on severity. So over 30 years, that's $61,000 to $272,000 in benefits. But more than money, it's recognition. It's validation from your country that your service caused this condition and that you deserve support. Let me tell you about Sarah. It's not her real name, but her story is real. Sarah deployed to Iraq in 2008. She was an army mechanic. Every day she worked long hours in extreme heat, lifting heavy equipment, breathing in burn pit smoke, sleeping 4 hours a night on average, high stress, combat vigilance, right? When she came home in 2009, she just never felt right. She was exhausted all the time. Her whole body ached. She thought maybe she was just getting older, or maybe she was depressed from the deployment. So she went to her doctor, and she went to another doctor and another. They tested her for Lyme disease, lupus, rheumatoid arthritis, multiple sclerosis, and everything came back negative. One physician suggested antidepressants. Another suggested that she was just stressed. One even suggested that it was all in her head. By 2015, 6 years later, Sarah had given up. She was working part-time because she couldn't handle full-time anymore. Her marriage was strained. She gained weight because exercise made everything hurt worse. She was deeply, deeply depressed. Then she saw a rheumatologist who asked the right questions. 20 minutes into the appointment, the doctor said, "I think you have fibromyalgia." She ran through the diagnostic criteria, and Sarah met every single one. For the first time in 6 years, someone believed her. Someone told her it was real. Sarah filed for a VA claim for fibromyalgia as a presumptive condition related to Gulf War services, and she got 40% rating. That's $755 per month. She used that money to pay for treatments the VA didn't cover. She started physical therapy, tried different medications, and made lifestyle changes. Is she cured? No. Fibromyalgia doesn't have a cure, but she is better. She's working again. Her marriage has improved. She has hope. That's what's at stake here. That's why proper diagnosis matters. That's why I'm making this video for you. So let's start from the beginning. What exactly is fibromyalgia? Whether you're watching this from the United States, the UK, Australia, Canada, or anywhere else in the world, this information applies to you all. Fibromyalgia is a chronic condition. It's characterized by widespread musculoskeletal pain throughout your body. But it's not just pain. It comes with a whole constellation of symptoms. Think of fibromyalgia as your pain volume being stuck on max. Imagine if someone turned up the sensitivity on every nerve in your body. A light touch feels like pressure, pressure feels like pain. Your brain is receiving and amplifying pain signals that shouldn't hurt nearly as much as they do. Here's what's actually happening in your body. Research shows that people with fibromyalgia have alterations in how their brain and spinal cord process pain signals. You have elevated levels of certain chemicals called neurotransmitters, like substance P, that signal pain. And you have lower levels of chemicals like serotonin and norepinephrine that normally help regulate your pain. It's called a central sensitization, meaning your central nervous system becomes hypersensitive to the pain and other stimuli. So this is not a psychological problem. This is not all in your head. This is a neurological condition with measurable changes in a brain chemistry and function, in your brain chemistry and function specifically. So the most common symptoms of fibromyalgia include widespread chronic pain. So pain on both sides of your body, above and below your waist, affecting your back, your neck, your shoulders, your hips, your arms and legs. It often feels like a constant dull ache that won't go away. You get extreme fatigue, meaning you wake up exhausted. Even after sleeping 8 to 10 hours, you feel like you have no energy, like you're carrying extra weight with literally every movement, you feel like you're carrying extra weight. You get sleep problems, difficulty falling asleep, staying asleep, or even achieving deep restorative sleep. Many people with fibromyalgia also have sleep apnea or restless leg syndrome. Then you have what's called the fibro fog. It's cognitive difficulties, including problems with memory, concentration, focus, and even word finding. You may even forget why you walk into a certain room or lose track of your conversations. You can get morning stiffness, waking up feeling stiff and achy, and taking hours to loosen up. You get sensitivity to touch. Actual light touch can be painful. So putting clothing, hugs, or even gentle pressure can hurt. You get sensitive to temperature. Many people will say that they're unusually cold, or it especially hurts their hands and feet when they're cold. You can have headaches and migraines, irritable bowel syndrome. So that's digestive issues, including bloating, constipation, diarrhea, or even abdominal pain. Mental health issues like depression and anxiety. Often they will accompany chronic pain, and sometimes they precede it too. So who develops fibromyalgia? Anyone can really get it, but of those that get it the most, it's women. They're affected more often than men. About 7 to 9 women for every man, typically. And it will typically develop between the ages of 30 to 50, though it can occur really at any age. It will often run in families, suggesting a genetic component, and it's frequently triggered by physical trauma, infection, surgery, or maybe even significant psychological stress, like the military. So fibromyalgia affects about 2 to 4% of the entire global population. That's roughly 200 to 400 million people worldwide. In the United States alone, about 4 million adults have fibromyalgia. In the UK, about 2 to 4% of the population. Australia, similar rates. This is a common condition, even though many people have never heard of it. And there's something critical. Fibromyalgia is especially common among military veterans and active duty service members. Some studies show rates as high as 7 to 10% in veteran populations, more than double the general population. Why? I want to dig into that. Let's talk about that. Military service is uniquely suited to trigger fibromyalgia. Let me explain why. So you've got physical trauma and repetitive stress injuries. So military service is a physically demanding job. You're carrying 60 to 100 pound rucks for miles on end. You're loading ammunition, equipment, supplies. You're climbing in and out of vehicles, aircraft, or ships. You're doing physical fitness training every morning. You're jumping out of planes or fast roping from helicopters. All this creates cumulative physical trauma, and research shows that physical trauma over time is one of the strongest triggers for fibromyalgia. And then there's chronic sleep deprivation. In the military, especially in combat zones, you don't sleep well. Surprise. You're on guard duty, you're on patrol, you're hypervigilant because your life depends on it. You might average between 3 to 4 hours of sleep per night for months. Sleep deprivation causes profound changes in your nervous system. It lowers your pain threshold, it affects hormone regulation, it increases inflammatory markers, and it's a major risk factor for fibromyalgia. What about psychological stress and trauma? Well, combat exposure, witnessing trauma, losing fellow service members, constant high alert status, these create tremendous psychological stress, and psychological trauma directly affects pain processing in the brain. There's a very, very, very strong connection between PTSD and fibromyalgia. Many veterans actually have both. What about environmental exposures? Very common to hear about this, right? Burn pit exposures. What about contaminated water, chemical agents, extreme temperature, infectious diseases? Military service, especially in combat zones, involves exposure to all kinds of environmental hazards. These exposures can trigger immune system changes and inflammatory responses that contribute to fibromyalgia. What about post-traumatic triggers? Sometimes fibromyalgia develops after a specific injury or incident, like a vehicle accident, a fall, blast exposure, or combat injury. The initial injury heals, but then the pain doesn't go away. It spreads, it becomes chronic. That's fibromyalgia. I had a patient, let's call him James, who deployed to Afghanistan, had an IED blast with a traumatic brain injury, multiple orthopedic injuries. He went through months and months of recovery, physical therapy, and surgeries. His bones healed, his wounds closed, but the pain never left. In fact, it got worse. It spread throughout his whole body. He was exhausted constantly, couldn't think clearly, couldn't sleep. 3 years after his injury, he was finally diagnosed with fibromyalgia. The blast, the trauma, the stress, it all triggered changes in his nervous system that led to chronic widespread pain. So if you're a veteran watching this and you have widespread pain, fatigue, and cognitive difficulties that develop during or after your service, you might have fibromyalgia. And you might be entitled to what we call VA disability compensation. So let me show you exactly how. All right, so first, and this is the first piece of advice I want to give you. If you suspect you have fibromyalgia, you need to get properly diagnosed, and here's how you accomplish that. Step 1, go see a doctor, ideally a rheumatologist. Now, I want to be clear, you do not need to see a rheumatologist to get diagnosed. Your primary care doctor or provider, your VA doctor or provider, even a physician assistant or nurse practitioner can technically diagnose fibromyalgia using the standard criteria. But my personal advice, as a physician, if you can see a rheumatologist, do it. And here's why. Rheumatologists specialize in conditions like fibromyalgia, arthritis, and even autoimmune diseases. They are experts in complex pain conditions. They are familiar with the latest diagnostic criteria, and their diagnosis carries weight, especially if you're filing for VA benefits or disability in any system. If you can't assess a rheumatologist, that's okay. But if you can, do it. So step 2, come prepared with your symptom history. Before your appointment, write it all down. Where is your pain? Where do you have it? Is it And I want you to be specific. Is it in your neck, your shoulders, your back, your hips, your arms, your legs? How long have you had the pain? Has it been months or years? How severe is it on a scale of 1 to 10? 1 being the least, 10 being the most. What makes it worse? Activity, stress, weather, lack of sleep? What actually makes it better? Rest, medications, heat, ice? Your fatigue level and sleep quality? Any cognitive difficulties in your memory, concentration, or that brain fog? Or do you have other symptoms like headaches, migraines, IBS, sensitivity to touch or temperature, or mental health things like depression or anxiety? The more specific and detailed that you are, the easier it is for the doctor or provider to make an accurate diagnosis. Step 3, understand the diagnostic criteria. The doctor or provider will use the 2016 American College of Rheumatology criteria. And with this, they will assess specific things. One of those things is called the WPI, which is the Widespread Pain Index. They'll ask where you've had pain in the past weeks across 19 different body areas. Each area counts as 1 point for a maximum of 19 points. Then they have the symptom severity scores, SSS. They'll rate the severity of fatigue, sleep problems, and cognitive difficulties on a scale of 0 to 3. Plus, ask about headaches, abdominal pain, and depression in the past 6 months. You get a maximum of 12 points there. They'll look for things like duration. Symptoms have to have been present for at least 3 months. They look for generalized pain. Pain has to have been, in at least 4 or 5 body regions like the left upper, left lower, right lower, and the axial central section. If you meet these criteria, you have fibromyalgia. The provider doesn't need to run a million other tests first. If you meet the criteria, that's the diagnosis. Step 4, get it all documented. Make sure your fibromyalgia diagnosis is in your medical records. Get a copy of the doctor's note. If you're a veteran, make sure it's in your VA medical records or your private medical records. This documentation is critical for any disability claim. Okay, so right now I want you to pause here. I want you to do something right now. If you've been experiencing widespread chronic pain, fatigue, sleep problems, and brain fog for more than 3 months here, and you haven't been diagnosed formally, I need you to schedule an appointment with a physician this week. Don't wait another month. Don't wait another year. The longer you wait, the more your nervous system entrenches these pain patterns. And if you are a veteran and you need help navigating the VA system or getting properly diagnosed or preparing a strong disability claim or a nexus letter or a DBQ, go to xterahealth.com right now in the comments. We specialize in helping veterans with complex conditions like fibromyalgia, and we'll guide you through the process step by step. So the link, again, is in the description. Go schedule that appointment or that free consultation. Do it now. Your future self will probably thank you. Okay, so let's keep going. Now, if you're a veteran and you've been diagnosed with fibromyalgia, let's talk about how the VA rates this condition. The VA will use Title 38 Code of Federal Regulations, or CFR 38. Specifically Section 4.71 Alpha or A, Diagnostic Code 5025. Fibromyalgia is rated at 10%, 20%, or 40%, depending on the severity of your symptoms. So I want to break down each rating clearly and rather quickly here. So the 10% rating means that symptoms require continuous medication for control. You've got fibromyalgia with widespread pain and associated symptoms, and you need to take medication daily or nearly daily to manage it. Things like ibuprofen, Motrin, gabapentin, duloxetine, Cymbalta, or muscle relaxants. And the monthly compensation for that 10% is about $171 per month. Then over 30 years, again, that's roughly $61,000. For the 20% rating, it means that your symptoms are episodic and present more than 1/3 of the time. So that means your symptoms flare up and down, they're triggered by stress, activity, weather, or other factors, and you experience significant flare-ups more than 10 days per month, or about 122 days per year, more than 1/3 of the time. The monthly compensation for that is about $538 or $338 per month over 30 years, about $122,000. 40% means that symptoms are constant or nearly constant and refractory to therapy, meaning your symptoms are present almost every day with little relief, even with treatment. You've tried multiple medications and therapies, but they don't adequately control your symptoms. You have significant functional limitations daily. Compensation is typically $755 per month, and over 30 years, it's about $272,000. Now, 40% is the maximum rating for fibromyalgia itself, but, and this is critical, you can claim secondary conditions related to fibromyalgia and get additional ratings for these. Things like depression secondary to chronic pain, IBS secondary to fibromyalgia, migraine second to fibromyalgia, sleep disorders. Each of these can be rated separately. I've seen veterans with a 40% fibromyalgia rating combine it with secondary conditions and reach 70, 80, even 100% combined ratings. Okay, now the final major teaching point. How do you establish service connection for fibromyalgia? There are specifically 3 paths. Path 1 is the primary service connection path. And this requires really 3 elements. 1, and the most important, you've got to have a diagnosis, a current diagnosis of fibromyalgia. And you have to have an in-service event that caused or triggered it, and it has to be documented. And you got to have that, and that's what we call the medical nexus. It is the link between the diagnosis and the event in service. In-service events can include combat trauma, blast injuries, vehicle accidents, repetitive stress from physical demands, chronic sleep deprivation, psychological trauma, infections during service, or environmental exposures. You're going to need service troop records documenting these events, and sometimes a next letter from the provider explaining the connection and a detailed personal statement describing what happened can help. Path 2, a presumptive service connection for Gulf War veterans specifically. This is huge. If you served in Southwest Asia theater, that means Kuwait, Saudi Arabia, Iraq, Afghanistan, on or after August 12, 1990, fibromyalgia is a presumptive condition under CFR 38, meaning the VA presumes your fibromyalgia is related to your Gulf War service. You don't need to prove causation. You just need to have the diagnosis. So you need to have proof you served in the Gulf War, in the Gulf War theater specifically. And that's going to be found in your DD-214 or your deployment orders. You need to have a current diagnosis of fibromyalgia, evidence the condition has existed for at least 6 months, and that the condition manifested by December 31st, 2026. That's it. The VA will automatically presume it's service-connected. If you are a Gulf War veteran with fibromyalgia, this is your easiest path to benefits. Do not overlook it. Path number 3, secondary service connection. This is when fibromyalgia develops as a result of another service-connected condition. So let me give you some common scenarios. So fibromyalgia secondary to PTSD from, say, psychological trauma, triggering pain processing changes, or fibromyalgia secondary to chronic pain from a back injury, a knee injury. So you get that chronic pain leading to that central sensitization. You could have fibromyalgia secondary to sleep apnea from poor sleep triggering fibromyalgia. What about fibromyalgia secondary to TBI or traumatic brain injury? So neurological changes can affect your pain processing. So the key here, and I want to emphasize it, is that for secondary service connection, you need a couple things, right? So again, just like everything, most important, you have to have a diagnosis. You have to have an existing service-connected condition you're trying to connect it to. Ideally, in this situation, you're probably going to need a nexus letter explaining how your fibromyalgia was caused by one of your other service-connected conditions. So whichever path you take, here is my professional advice. 1, just gather all of your evidence before you file. That includes your medical records, your service records, statements, any nexus letters, DBQs. Have everything ready. 2, write a detailed personal statement. Explain when your symptoms started, how they've progressed over time, how they affect your daily life, and how they connect to your service. 3, if you're not sure which path to take or how to build your claim, get help. Work with a veteran service organization or a VA accredited attorney or a medical consulting service like us here at Xterra Health. Filing a strong claim the first time is much better than filing a weak claim and spending years on appeals. So let me bring all this together. Your pain is real. Fibromyalgia is a legitimate neurological condition with measurable changes in how your brain processes pain. You're not imagining it. You're not weak. You're not crazy. Getting properly diagnosed is just the first step, and I strongly encourage seeing a rheumatologist if possible. Though, again, any qualified medical provider can make the diagnosis. For veterans specifically, fibromyalgia can be service-connected through primary, presumptive, or secondary pathways. Gulf War veterans have the easiest path with presumptive service connection. VA ratings ranges from 10 to 40% based on symptom frequency and severity, with potential for much higher combined ratings when you include secondary conditions. So if you're suffering from widespread pain, fatigue, cognitive difficulties right now, do not wait. Get diagnosed, get treated, and if you're a veteran, file your VA disability claim. You have earned these benefits. If you need help with your VA disability claim for fibromyalgia, again, visit xterahealth.com. We help veterans worldwide prepare strong claims, get proper documentation, and maximize their VA ratings. And again, the link is in the comments below. Now, in my next video, I'm going to dive into the secondary conditions related to fibromyalgia, the conditions that fibromyalgia causes or worsens, things like IBS, migraines, depression, TMJ, sleep disorders. Each of these can be rated separately, and claiming them properly can take your combined VA rating from a 40% to an 80 or even 100%. I'll show you exactly how to identify these secondary conditions, document them, and claim them so you're not leaving tens of thousands of dollars on the table. So subscribe, hit that notification bell, and I will see you in the next video. Remember, your pain is real and help is available, and you're not alone in this fight. So take care of yourself, and until next time, stay mission ready.